What if you have a client that comes in with low back pain and you decide it's time for you to work on their psoas muscle, which connects on the lumbar spine, comes all the way down to the femur? Anyway, how do you treat that? Well, first you got to decide what kind of postural pattern they're in. Do they have extension with the spine, meaning a lot of lordosis with tippage of the iliums going into a flexion state? Or do they have a flex spine to where it's flat like a pogo stick and extension with the iliums? What if they got a side bend, which the lumbar spine has got a little C curve at the bottom, and possibly this ilium could be flared out? A torsion, which means anteriorly rotated or in front compared to the other side. So treating that psoas muscle is done differently for each one of these patterns. Find out how to do that. I'll show you my secrets, what I've been doing for 25 years at our class, June 10th, Greenville, South Carolina. Go to www.csbworkshops.com. I'll see you soon.